What if I told you the secret to staying strong, vibrant, and healthy into your 70s and 80s isn't just about staying active? It's about building muscle and specifically about pelvic health. Today, we're unlocking why muscle is the real fountain of youth. Dr. Patricia Wallace, a leading expert in female pelvic medicine, is here to reveal how keeping your muscles strong can transform your life as you age. Stick around. This could change the way you think about aging. Dr. Wallace, thank you so much for making the time in your busy clinic and personal schedule to come on to this podcast. Our listeners and our patients tend to be very similar. So I'm so excited to introduce my listeners to you. Can you tell us a little bit about you, where you practice, and what some of your specialties are to really get the audience excited for our topic today?
Well, thank you so much for having me. It was such a pleasure to meet you recently. And I love that we are women advocating for women. And we understand what it takes to age well and to be strong from the inside out. So I'm a urogynecologist. That means that I did 4 years of obstetrics and gynecology, and then I did an additional 3 years of a fellowship in what's called female pelvic medicine and reconstructive surgery, which is otherwise known as urogynecology. So my specialty as a whole is very much a surgical specialty, but my passion has been able to branch out into other areas of hormone health, and then bringing in my fitness background, because I've been an aerobic instructor and an advocate of lifting weights since I was 15, and also a life coach, trying to really pull that all in. And my goal in the next 20 years of this stage of my life is to help my patients and women live their best lives in their best bodies. So that's kind of where this pivot is going to take me, hopefully soon. The sky's the limit. I'm so excited.
I'm excited for you too. Where do you currently practice?
I'm in Southern Orange County, which is basically Mission Viejo for those of you who know California. It's about an hour south of Los Angeles and about an hour north of San Diego.
Perfect. So you have a lot of people who are already kind of in that mindset about, I want to increase my longevity, but not just the length of my life, but the quality of my life. So they talk about health span. Tell me how you are going to incorporate that as you shift from a more surgical practice into a more holistic, to include the coaching and more about this muscle and fitness.
So it was always an interesting thing to me to figure out how to collide those two worlds, because again, I started out as a fitness instructor and I actually still teach fitness twice a week in a hot yoga studio. And I knew that for some reason, I'm 55. I looked younger than the average 55-year-old that was coming into my office. I knew that there was a little something to share. And I thought, you know what, it's really about that foundation inside and out. So in the last, let's just say 5 years, it's funny, I looked back and I started presenting slides in 2008 to my partner. We've got to talk about wellness. We've got to talk about wellness. And now wellness is the buzzword, but I'm thinking, like, how am I going to have my patients buy into the concept of you have to take responsibility for your wellness and your aging well? I mean, the anti-aging term is fine, but in the end, we want to age well, because aging is a blessing. It's a gift. It's a miracle. We get to live. We get to grow old. We get to wear those battle scars, but we also want to be functional and mobile and sexually active and vivacious and all the good things. So my goal is to figure out how to really translate that into my practice in a way that patients will not only settle for the minimum that their insurance, if you will, is going to pay for, right? I mean, they're going to pay for their illness, but maybe we can get ahead of the game and really start focusing on the wellness.
The wellness, the prevention, the graceful transitions from your reproductive years into your perimenopausal and menopausal years. One of the most impactful lectures that I've been to in a while was yours, and I believe you entitle it Muscle Matters. And I'd really like you to dive into that, because I preach muscle, muscle, muscle all the time, and I prehabilitate people before we do injections, and I rehabilitate people after we do injections, and we're trying to stay out of the OR and keeping that core strong and keeping those quad strong if you've got knee issues, rotator cuff strong if you've got shoulder issues, etc. So can you relate how muscle matters? And I believe you've even called it the fountain of youth.
It is. So it's interesting. All of a sudden, of course, the buzz on Instagram or whatever sort of social media platform you're on is like muscle is the foundation of longevity. And it is true. There is, or are, I should say, statistical information that says that the more muscle you have, and specifically like lower body muscle strength, translates into more survivability of all causes of illness and disease. And we think about it, and I'm an anthropology major, so I actually think about it even from the evolutionary standpoint. The stronger we are, the more able we are to be fit to take on the lions and the falls and gathering our food and all the things that we really had to do before we became these modern humans. And it makes so much sense. And so being strong muscularly, the amount of muscle you have, but also then functional wellness. So being able to do functional activities, I think is really the next stage. And we can't really start later. We really have to start earlier because we lose muscle after a certain age and we start to get degenerative changes in our skeletal system, and then it makes it painful. And so really gaining is a little bit more difficult as we age. And I was having a discussion with someone yesterday and they're like, well, how often do you work out now? And I'm like, I probably work out twice a week, but I have been lifting weights since I was 15. So again, not crazy. There were times where it was 6 days a week and there were times when it was not at all. But that muscle foundation is there and it will be there forever if you build it as soon as you can.
So all these 30-year-olds are thinking, is this really the right topic for me right now? Absolutely, because
100%.
that's when we do start to lose, right? Isn't it?
Absolutely.
You look at different percentages and it'll talk about in your decade, you'll use X number of percentage, or you say that every year you lose a X number of percent. It doesn't matter exactly the numbers, but it does matter that you build that foundation now.
100%.
So what do you recommend to our 30s and our 40s, your younger gynae patients right now?
Absolutely. So I think that luckily there's a little bit of a buzz out there, but I think it's very important that we focus less on the cardiovascular 45-minute workout. Like we're very much ingrained to think we have to do 45 minutes of cardio to lose fat, and rather focus on lifting weights carefully and very thoughtfully. Because it's interesting, I will watch some other social media influencers talk about lifting weights and deadlifts and these crazy sort of powerlifting things on your back. And remember, I'm a pelvic floor surgeon. So women can blow out their pelvic floors if they're lifting too heavy, especially if they don't have that strong internal strength. And so body awareness, working with maybe a physical therapist or a functional coach to know how to do what I call mechanics, body mechanics, and how to lift is first and foremost. But then building from the inside out at a young age before childbearing would be awesome. And then immediately postpartum, it's amazing to me how many OBGYNs do not refer their postpartum patients to physical therapy. They just need to go. Send them for 6 sessions, get some awareness, get some breath, get some technique. I mean, think about, we all carry these big, heavy, babies on our arms. We're crooked, we're lifting, we're bending over. And if we had better body mechanics and a strong core, we would cancel out so many issues that happen later.
Absolutely. We're seeing that now. You see it in the pelvic floor. I see it in the spine.
100.
Same thing. I almost cringe when I hear about deadlifts and power lifts because I see people with fissures in the discs of the lumbar spine or in the cervical spine. And I think a lot of it is about the mechanics and having the underlying core stability. So can we just break it down for people? What is the core? What does the core consist of? And why does it pertain to everybody, not just women?
So the core, as most of us think, is really our abs. And I don't think anybody else thinks about the back muscles, the glutes, right? Because our glutes are long back muscles straight down the back, and then our pelvic floor. And so I love to talk about core to floor because you call it the Tower of Power. It's basically that top and bottom of your trunk. And the trunk is so responsible for how we stand upright as a human. You know, this is the heaviest part of our body over these long or short legs, but there's really not much that's keeping us upright. Again, the pelvic floor really keeps that trunk stable over the legs and the hips. The wider the hips, you know, we are able to walk upright, but then we've got these knees. And if we don't have strong quads, then the knees hurt. So it translates to being strong really from the toes up to the top of the head, because the neck, you know, is getting impacted all the time too. So cortifloor is basically, when you think about it, diaphragm to pelvic floor, because that's a diaphragm on the top, and the pelvic floor is called the pelvic diaphragm as well, and it encases your organs and those truncal muscles that make this cylinder and keep us super stable. But we can't forget the bottom, and everybody does not think about the pelvic floor. And men don't know that they have the same pelvic floor as women, and they need a strong pelvic floor too.
Completely agree. Not just in talking about the mechanics, or we talk about the chain, the kinetic chain that works all the way up, but we could dive. I'm okay with it. You are big into sexual health and big into women enjoying and living life as they age. It pertains to men as well, and having a strong core pelvic floor. Tell us the one-to-one translation.
Right. So men and women have the same pelvic floors. And the only difference really is a single separation of a muscle that's fused in men, and women is open and it surrounds the vaginal opening. That's called the bulbar cavernosus. And so men don't really think about their pelvic floors because they really don't pee their pants. And women start to think about their pelvic floors when they pee their pants, when they're jumping jacks or jumping on a trampoline. But if a man has a radical prostatectomy, then 95% of men are going to have some urinary leakage. And that is completely unacceptable to a male who never knew what a pad was in his entire life. But also, men begin to have erectile dysfunction at certain ages. A certain percent per decade are going to have less blood flow into, you know, the penile caverns, if you will, and therefore their rigidity goes down. And if we can actually build their pelvic floor and improve that blood flow, they'll be able to have that nice erectile function for life. So we're living longer. Women can have sex forever. We love for our partners, whether they're male or female or whatever you have, can be together and have this lovely intimate relationship forever. But we have to pay attention to our tissue. It's so hard to get it back once it's gone. You really need to get ahead of it. And that's, I think, the next step is like, how do we get that knowledge out there? Like, or like, I'm fine. I'm like, well, let's keep going, you know?
Right. You may not be fine in a couple of years. Let's set the foundation now, literally foundation. So, do you want to dive into some of the ways that you do that mechanically? And then we can springboard into how nutrition plays a role, anti-inflammatory eating, all those things, obviously, but kind of where how somebody's looking at you going saying, I'd like to take care of that now. I'm in. What do I do?
Right. Well, I mean, there's different ways to do it. Certainly, I always advocate for pelvic floor physical therapy, which is a way to learn technique and breath. And if you don't have technique and breath and muscle awareness, you're never going to sort of have a long-term success. And then we have different devices, of course, that I have in my practice that build muscle passively that you do not need to do anything. And I think there's really not much out there that can rival the ability to truly cause pelvic floor strengthening and hypertrophy, much like magnetic energy. And then we have to think about hormone optimization and protein intake, because we are bodybuilding, right? We're bodybuilding from the inside out. And so I would say that's the newest piece for me at this stage of life is I have to tell my patients that are in their 70s, in their 80s, because my youngest patient is 16, my oldest patient is 105. She's amazing. That your protein intake and how you feed your body is so important. And so it really is that multifactorial approach. Not one thing is going to give you the fountain of youth, but if you can touch upon all these things, and I'm realistic, not everyone can hire a personal trainer. Not everyone can do this, that, the other, and meal prep and take creatine. And so I'm like, let's start small, but let's try to hit each one of those points.
Great. So if a person came in and they wanted to do more of a DIY and work with you in that I'm the urogynecologist and I'm a health coach and I want to keep you thriving throughout your transitions, what kind of things would you have them do in a more of a DIY with their own, even how they shop, how they eat, how many grams of protein are they going to supplement, when do they start hormones? There's so much to address.
It is a lot. And I think that a lot of people think like, well, I want to be as natural as possible. But you have to remember, anthropologically, 200 years ago, we died at 45 after we're done having babies. So now we've sort of, extended that lifespan double. Like the average woman lives into her late 80s. And believe me, I see women in their late 90s every day. So we are living longer than even that projected, sort of age cutoff. And I would say that we have to, definitely increase the protein. And there are minimums out there. I be realistic, 30 grams a meal. Of course, you should be eating about a gram per pound, but I couldn't get 130 grams in a day if I tried, right? But really, that would be the goal, 30 grams per meal. Make sure that the first thing that touches your lips after your break fast is protein. So your insulin doesn't shoot up and you have this nice little, start to your day. Definitely, you need to lift weights. And again, starting small. I tell patients, I have right there over there in my living room, there's like 8 pounders. That's not enough for me, but they're sitting next to my couch. And so if I'm chilling and watching a movie, I'm just going to pop out some biceps and I'm going to do it to fatigue. Realistically, if you're going to lift some weights, you want to go heavier. If you can get up to a count of 10, drop it and get the next ones until you're fatigued. That's going to build muscle, and building muscle is probably the key, not just toning, because there's lots of things out there we can do to tone, and that's great. But in the reality, we want to build a little bit too. And then, of course, I test everybody for hormone imbalance, and all of us have low hormones after the age of 52, 53. And having that deep discussion, which, by the way, is a good 45-minute consult, dispelling the myths of hormones and why they're so important. Again, what was good for you at 51 is not bad for you at 52. And if your body has this natural supplement that you no longer make, then that makes sense to me. And most of my patients understand that that makes sense to extend your long life, your health span, your longevity.
What was one of the things you quoted about how we outlive our endocrine glands, from the thyroid to the ovaries to just, and how important that is if they were only meant to last 45 years and their lifespan has not kept up with our lifespan. So it'd be like living about half of your life with a fatigued thyroid and kaput ovaries. And so I think that really should enlighten patients and say, wow, yeah, I don't want to live half my life deplete.
Right. So it's interesting. I will talk to patients every day. I'm like, if your thyroid, like your primary care doctor says, your thyroid no longer makes enough thyroid, you're going to take the prescription for thyroid medication. But I'm like, technically, you're getting thyroid hormone support. And so your ovaries no longer make what you need. So I'm going to give you a prescription to give you back what your body is missing. And by the way, you're going to live longer on the average of 3 to 4 years. You're going to reduce your risk of cardiovascular disease, osteoporosis, and dementia if you give your body back what it misses. And I feel like everybody's so worried about, of course, the Women's Health Initiative and the breast cancer mythology that came out of that study, that it is a very big discussion to unpack. And luckily, there's lots of influencers and Oprah and Halle Berry, and everybody's going through menopause and they're like, this is crazy. And that helps because at least it brings awareness to the fact that we've been having the wrong conversation for 20 years.
Agreed. There's some that say an entire generation of women missed out on the ability to age gracefully and increase their longevity, decrease their cardiovascular risk, decrease their dementia risk, decrease all these things with exogenous hormone replacement. So I am so happy to shout from the rooftops that the Women's Health Initiative was exactly that, myth. That's not what I've looked at the numbers. That's not what the conclusions were, but there were some mouthpieces that brought that out. But I won't dig myself a little hole right now. But yes, I completely agree. Can you explain why, in particular, women who put the hormones back in with a bioidentical hormone replacement can then continue to build muscle when, say, a peer, it could even be a twin who's not on the bioidentical hormones, and one can put on muscle and one can't? And it's not just maybe estrogen. You may be adding in some T and your relationship on estrogen and testosterone.
Sure. So it's interesting, as a OBGYN and then Urogyn, like, and other providers have talked about this. We get very little training in our medical school and even in our residency and then fellowship. Like, before I went into private practice, was assistant professor at local UC Irvine, and they would bring me back to talk about sexual health because who's the sexual health person? And it was like Dr. Trish. So I was so passionate back then, not even knowing anything, because I thought there's something more to this. And then I realized, as I sought outside certifications, outside learning about hormone health, and they're out there. And the challenge is our primary care doctors and our regular sort of OBGYN doctors who are, sort of stuck in the weeds, are really not educating themselves about the newer studies, and not even the newer studies, the studies that were going on all along, and still telling our patients that they're going to have a heart attack or get breast cancer. So I am a huge advocate for hormone balance, and that includes estrogen, progesterone, testosterone in women, and in thyroid health as well, sometimes adrenal support. So I look at all of that, and now also even hyperinsulinemia and, insulin resistance, and how small doses of peptides can help women sort of achieve their better bodies. I'm a big advocate for testosterone. I use that in myself. I use it in my patients. There are patients who cannot take estrogen. I still will put them on testosterone because it's breast protective, it's muscle building. It just gives them that pep in their step. And what's amazing is I sort of get these women dialed in, and then all their partners come in to get themselves dialed in too, because they realize, wow, like, I am lacking in something in my 50s that I didn't really know. And I observed in my practice, and I was sharing this with patients, I think that pivotal decade, and I realize now why that is, because it's 20 years after Women's Health Initiative. The pivotal decade in my practice is the 70s. I see these 70-year-olds that are using walkers on 5 meds, very ill. And then I have a huge gap. And then I see all these 95-year-olds who are like running in here doing so it's a very interesting decade. Now, I don't think that's going to be the same for us, because we're all supporting ourselves mostly. And I think that, hopefully if something big doesn't hit us, we're going to live longer and longer and longer. But yeah, I'm a huge fan of hormone support, physiologic restoration, and sometimes even a slightly super physiologic restoration when it comes to testosterone in women, depending on the person.
Absolutely. You did mention a little bit of peptide, and I want to tie this in. It may seem like it's going to take me a second to get there,
Sure.
but with the GLP-1s and rapid weight loss, I could even say it's after a gastric banding or something surgical, but whenever there's a rapid weight loss, as we're seeing often with the Wegovy's, the tirzepatides, semaglutides, we can see up to 40% of that weight that is being lost as lean mass, and that includes muscle.
Mm-hmm.
And when we're talking about how muscle is so important for longevity and build muscle, build muscle, build muscle, what are we going to do to balance these people out? Because obviously they're getting healthier by losing the weight, but we don't want to lose the wrong kind of weight. How do you take care of these patients?
Right. So in my practice, we have actually adopted also a sort of protocol for peptide weight loss, but it's a supervised peptide weight loss, because I want patients to know from the beginning, you have to invest in your protein intake, and you absolutely need to do some sort of resistance training. And resistance training is probably not enough, but in these patients, a lot of them have a larger weight to lose. They're doing nothing. So I'm like, let's just 2 days a week, we're going to do a 10-minute goal of doing something. And then of course we can build on that. But it is absolutely true. We lose up to 40% of our muscle, at least, lean muscle mass, when we lose weight. So it's always upfront. If you don't do this, you are going to be, and I hate the term, skinny fat, right? You're going to lose all this weight. Your skin's going to fall off your body. and you're not going to actually maintain the weight. So the biggest thing is, there's like a little gnat trying to attack me. The biggest thing is that if you have weight on your body that is muscle, you will maintain your weight loss goals for a long time. And in fact, hopefully, like myself, I can attest to this, where I don't have to kill myself in the gym now all the time. Because I have a foundation, I can have some weeks that are really, it's really hard to get in that workout, but yet I have the muscle foundation. And so it's the way to maintain the metabolic activity. If you have more muscle on your body, your metabolism's higher. Your little engine in your muscle, those mitochondria, they're revving up all the time. They're repairing, they're allowing you to be more youthful. And so it is, that's how I address it in my practice. I do a few supplements. I'm not quite there about saying like you need this much creatine, but I do talk about the protein intake and the lifting of the muscles. But I think there are many things that we can do to further enhance our ability to maintain the muscle.
I think it's crucial. And I wish that almost everybody had a contract, as people were coming in and saying, this is a partnership. You and I are walking down this road together, and I want to make sure you succeed. So in order to get this prescription, this is what we both need to agree upon.
Well, and I do have them sign a little consent about like, this is us. We have to do this together, because it's going to come back if you don't commit to this lifelong change.
Agreed. And I just know that not a lot of people out there are doing that. There are a lot of the people that are getting things online, or these other things that are not supervised and not medically directed and worked through, where you can also pay attention to, wow, we're following your labs and we've seen some changes in your liver enzymes. We need to do something else, right? If it's, too high of T or too low of whatever it is. So I just appreciate that this is being done from a very high level, supervised physician practice that is just above and beyond. So congratulations.
Well, I want to share something with you. On Friday, I saw a friend and colleague who I am treating, who's a very tall gentleman who's in the 300s of his weight. And we started him on hormone therapy as well as peptide weight loss. And it's been about 3 months, and he only lost, in his words, 15 pounds. So I put him on my body composition analysis device that we started at the beginning and we started at the end. And I happened to use a Staiku. There are other ones out there. And I said, let's check your numbers. He had lost 24 pounds of fat, had gained 9 pounds of muscle, and 6% body fat. But yet on his scale, it was only about 15, 16 pounds total. So you cannot underestimate. And I saw him, I said, your body composition is way different than I saw you last time 3 months ago. And he works out hard. It was nothing more than he was, has hyperinsulinemia. He's got some resistance. Maybe his eating habits weren't as good. But I was so excited to see the changes. And he was so pumped because now he's motivated to keep going. And I was just so excited to see that his body composition, visceral fat, subcutaneous fat, everything had gone down. It was amazing.
And his muscle mass had increased.
Had increased.
Muscle is king.
On terzepatide.
I love that.
Yeah.
That's fantastic. So we've talked about the endocrine system and the sex hormones. We've talked about even adding in peptides and how that plays a role in muscle. What are some of the other major lifestyle changes as a health coach do you talk about? I mean, I talk about sleep, I talk about stress. What are some of the ways that you address that with your patients?
Sure. So, and all the good things. And most of us, we have access to some of these things, but in the end, it starts with habit. And so a good sleep routine, waking up at the same time and going to bed at the same time every day. I think optimal health really involves like proper nutrition, hydration, proper sleep, some sort of mindfulness or mental health practice, whatever that is for you, whether it's your prayers, or it's your yoga, or it's your journaling, or it's all of the above. And then you have to move into hormone balance, right? And then you have to move into movement. And I'm sure there's other things we can add into that, but it really does take all of those things. And we're not going to be perfect at every one, but if we can touch upon each one of those things, I think that we're definitely working towards a more optimal health. And when we work towards optimal health, we have reduction in chronic illness for sure. And the number one cause of death in the United States is coronary artery disease or some sort of heart related condition. So if we can reduce that and reduce bone loss, which then leads to fracture later on, right? And then dementia, which is another illness. Those are the biggies. And
Right.
then we can enhance our sexual health at any age and stage. I love that my couples in their 70s and 80s are still intimate. And I always tease like sex is not just intercourse, like it's all the good stuff that goes along with it, right? And so if we can just keep that going, that's amazing because that makes you feel good and having community and having a purpose, I think that's important as well.
Absolutely. The independence, the purpose, the community, the ability to go and do. We've talked about people who just work and work and work and work during their time. And then when it's time that they're supposed to go, 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 they've accumulated all these chronic illnesses and then they skip the go-go years and they move into the no-go years. And we're trying to push that out,
Mm-hmm.
push that out so people can really truly thrive with muscle, with bone, with vibrance, with energy, with all these things. So I love this. Thank you so much for kind of encapsulating that and being able to put it on, because I think people can say, I can work a little on this, a little on this, a little on this, and not feel so overwhelmed by, oh my gosh, this huge list. But if you're touching on these little bits, then that helps put it all together.
Yeah, I'm trying to be realistic and pragmatic with my patients. I mean, I understand the average person's not going to spend 2 hours in the gym with a trainer and make their meals and do all the protein things and take all the supplements. And I'm like, most people just need a little bit of each thing. And when they see a little positive change, then they're going to feed into the next step. And again, it pays off in the end, but you have to be consistent. This is the thing that I feel like is the most important. You have to be consistent, and you do have to be a little disciplined. Like it's a learning process. You definitely need to be somewhat disciplined in your approach to all of those things.
Completely agree. What have we not touched upon? I
Hmm.
know we had such a list of
Let's
things
look
to
at my
attack.
list. So, well, I don't know. Tell me about the Tower of Power because that's the same thing as Court of Floor. Like, I want to talk about that. It's the same thing,
Yeah.
right?
So I do involve from the base of the skull all the way down to where you sit, because as you mentioned, that those muscles that attach to the base of the skull go all the way down to your sacrum. And if any weakening along that whole area, then you've got issues on the backside. And of course, I want my people to have tight tummies, but it's not just about getting strong bellies. We have to work on the back as well, because if you don't have that tight tummy holding things in, you've got the little Buddha belly, then it does put the strain on the low back. But if we function with this cylinder that
Mm-hmm.
really is our trunk, we take off our arms, we take off our legs. That's the Tower of Power. That's all those things that you talked about. Unfortunately, a lot of people don't get that pelvic floor in there, but
Right.
I do expand it all the way up. I take it above the diaphragm and actually call it in here too, because this whole cylinder can create that sense of stability that then branches out into the arms and branches down into the legs.
Yeah. It's amazing because in my practice, I have again patients of all ages, and I see people come in with canes and walkers, and again, partially insurance based, partially cash based practice. And I'm like, oh my gosh, I have so much I want you to do. Like I really want you to sit on my chair. I want you to do this. I want you to do that. And it's a little bit difficult because our insurance again just pays for that illness piece, but not the wellness piece. And let's pray someday that we can sort of merge those concepts, because I know that the patients will be better off if we can address it earlier, and
Right.
really get ahead of that muscle loss and that loss then of function, which leads down that road of really early mortality, right?
It does. The early dementia, because you're not out there being stimulated from the environment and going and doing
Right.
all those things. Yeah. And back to the Tower of Power briefly, when I look at MRIs and the cross section and I see that the muscle has been replaced by fat,
Yes.
and it could have come from me 20 years ago when I was still burning nerves, or it could be from a colleague who's still burning nerves and denervating the nerves that go to those muscles, that then the stability of the spine goes.
Oh, wow.
So how can a person really rebuild those tiny, tiny little muscles that may be, up in the cervical spine, like my pinky, or down in the lumbar spine, like probably bigger than my thumbs, but thumbs.
Sure.
And sometimes it's more than you can get of just doing an extension exercise at the gym. And if you're already sore, that's when I do bring in the machines. That's when I do add in the ability to use the magnet-based therapy and the electromagnetic therapy to strengthen those muscles that have been so weakened. So it all then begets the independence and the ability then to thrive as you age.
Well, and it's amazing because we've had electrical stim for a long time, and we understand that stimulating the muscle is a good thing. And we just now have better technology to truly re-educate the muscle, incorporate that full total contraction. And then we know now it stimulates the nerves, because why does that work on the bladder? Why does it work on orgasm? That's a whole nother talk, right? How does it help with that whole aspect of that pelvic health area? I think it's pretty amazing that we have those tools at our disposal, and it would be remiss if we didn't offer those to patients, because those are things that can take them to the next level.
Right. Non-operatively, no
Absolutely.
hardware.
Absolutely.
Right. Yeah. Oh, that's wonderful. I am racking my brain on other things. I think that honestly, we could have a whole nother episode, but for this episode, is there something that you think we've missed? Is there something you wanted to pound back in as, boy, this is really the focus? And then how do people find you?
So I would say, as we started the talk out, is that probably muscle is the fountain of youth. And if you think about the 600 plus skeletal muscles on your body, right, all of those muscles need to be strong, and you need to have muscle awareness, and not forget about the muscles from the inside out. And as a pelvic doctor, a sexual health doctor, that, being strong there too is super important for, your mobility, your function, but also your sexual health, your bowel and bladder continence. I mean, all of those things are so important. And even if you're not having issues, addressing that health before, because we know after a certain age, we may actually have issues just by the natural process of aging. And so I am sort of on this new journey to educate my younger patients and say, like, I hope you put us out of a job, because you are building your body, your health, your everything you need to live long and live strong from the inside out now, right? But it's never too late. I want my patients who are also more senior to also address those issues, because we can always help, but we also want to try to prevent. And you can always find me on Instagram at Dr. Trish MD. You have to spell it out, because there's another Dr. Trish. And my practice is called Pelvic Health Wellness. And so if you go to pelvichealthwellness.com, you'll find us as well.
Perfect. We will put all this in the show notes. So if you don't have a pencil and paper right now, it will all be listed there, as well as links to the website and to her Instagram. And please do reach out if you have any questions. And if they come to me, then I will forward them to Dr. Trish. I want to thank you so much. And we look forward to your questions. We look forward to educating a whole other level of ladies and gentlemen from their 20s, 30s, all the way up into their 90s and 100s. Mm-hmm. So thank you again, Dr. Trish Wallace. It's been a pleasure.
Thank you, Dr. Penhollow. I'm so glad we met, and I look forward to seeing you again soon.
Sounds good. Take care.
Take care. Bye-bye.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.